YouTube. It's just because we have a very small YouTube channel and I'm just trying to put little clips on there. I'll try to remember to, in fact, I must turn it off before we do the mock test today because I'm not allowed to publicly show the materials from the class, okay? So we're going to also record to the cloud. Guys, microphones off, please. And please just let me know if you're not available to speak today, right? If you can't talk, let me know. Type in the chat box. Otherwise, remember, SET classes, they're very interactive. It's just like a normal class. So you have to be ready to answer my question if you're free, okay? So just let me know in the chat box if you're not free. Let's start the class. Okay, so this is OET reading. We're going to be looking today at Part A again. We're on Wednesday. We looked at Part A yesterday, but we're going to look again at reading Part A. I will basically review everything from yesterday, and we will be doing today a mock test, a reading mock test. So can everyone see my screen? Does everyone see this here?
Yes.
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 Fantastic.
Yes.
So this is going to be, Ale, this will be our warm-up game. As I said yesterday, we studied this. Well, what day, guys, did we study this vocabulary? What day?
Monday.
Monday.
So we studied this on Monday, and every day I'm just trying to remind you, you know, like to try and test you on it. So it's a very simple game to start the class. It's just a warm-up game. The game is this. I will describe one of these words or give a definition or a synonym. You need to put your microphones on and shout out the answer, okay? Keep your microphones off until you're ready to speak. Okay, so Huma, I could just hear you there. Just keep your microphones off if that's okay. All right, so first one, this word means to separate, really. It just means separate.
Segregate.
Okay, now there are political meanings to this word, but it just means to separate. Okay, this word means to occur or to happen. It's actually a phrasal.
Take place.
Take place.
Oh, nice, nice. Okay, this is a word which means kind of to finish a task.
Turn around.
Turn around.
And we usually use it to talk about the amount of time it will take to finish it. Turn around. Okay, this means this is the this is actually just the adjective form of the verb derive.
Derivative.
Pronunciation.
Derivative.
Derivative. Okay. Let's all practice it actually because it's difficult. Listen to me. Derivative. Now you.
Derivative.
1, 2, 3.
Derivative.
That's better. Derivative.
Derivative.
I won't spend too much time on this because, as I say, this is just a warm-up game. This is a word that means someone who doesn't really know how the world really is.
Oh, never.
Naive.
Naive. Okay, so you do not know how the world really works. Okay, maybe it's easy to fool you, to trick you. Okay, this word means, guys, story, basically a story, personal story.
Subjective.
Anecdotes. Well, subjective and objective we did yesterday as well, but story is anecdote. Okay, last one, and we're going to start the class. Okay, microphones off, please. This means occasionally.
Periodic.
Yeah,
Periodic.
it can mean repeatedly. Well, it can mean repeatedly, okay, or frequently, I guess. Okay, so guys, please make sure that you review the vocabulary from Monday. Do it with me, but do it every day yourself. And next week, I'm going to test you on these words. Today, though, we're doing a reading class. And as usual, I want to try and do 3 things. So this is reading part A. And we're going to start off with a review of technique. And then we will go on and talk about answering questions. Okay, so basically step 2. And then we're going to do 20. Well, basically, we're going to do a mock test. Okay, so that is the structure of today's class. Let's get started then. So let's do a quick review. Could I speak to one of you here? Maybe Wenhan? Sorry, or Wen-chan, sorry?
Yes, I'm here.
So what did I talk about yesterday? Do you remember the diagram from yesterday?
Sorry, I didn't hear yesterday.
Oh, it's okay. It's okay. Guys, does anyone remember what I was
about malaria?
This one from yesterday, the overview. Does anyone remember this? I'm sure you do.
Yes.
Okay. So Hussein, right?
Yes.
Yesterday, I made a diagram for you. Okay.
Yeah.
And just let's go from the beginning, Hussein, in this diagram. What is this? What do you?
These are 4 texts.
These are the texts, right?
The texts.
In my diagram, these 4 squares are the texts. Okay. And we call this, Abdullah, could you put your microphone on? Or Ale, Paula, Petruta? We call this step what? Step
1.
Step 1, okay? In step 1, we're going to be analyzing texts. How much time should we spend analyzing text? Everyone, it's on the screen.
2 minutes.
2 minutes.
Approximately.
Say approximately 2 minutes, maximum 2 minutes, no more, okay? Maybe you can do it in 90 seconds, actually, right? It depends. Okay, so we talked about step 1 yesterday, all right? And I told you that for step 1, you're going to be trying to find these things, right? So Renu, can you say hello? Everyone else, microphones off, please. I can hear something. Just keep your microphone off. Renu or
Yes,
Bilge?
Yes,
what do we call these?
uh,
Said.
these are like subheadings.
Well, Renu, you might not have a subheading. Remember we said yesterday, you don't always get a subheading. These do not represent subheadings. No. Can anyone help her? What does this represent?
Main idea.
Main idea.
Main idea. Okay, right. And remember, guys, Renu, what are we trying to do? What's the main purpose of step 1? Do you remember? Bilge and Raisa as well?
Getting the main idea and finding the keyword.
Well, why do we want the main idea?
How to follow the question? How to follow the question?
Differentiate it.
Easily
It's on the
answered.
screen. It's on the screen. We're trying to differentiate texts. Okay, we're trying to see the differences because that means we can get the answers faster. All right. So this represents what we call main idea. Usually, main ideas are like this: treatment, medication, diagnosis. Now, there's a bit of a problem here, right? Because this one's medication and this one's also medication. So this is not differentiated. Okay, but this is main idea. We talked about this yesterday, right? There are 4 ways to get the main idea. Najibullah, could you say hello? Or if we could speak to Daniela, what are the 4 ways to get the main idea?
Yes, subheadings.
Subheading, yeah, what else?
To read the first line.
First line, what else?
Also to repeated words if we see words in the text, and also thematic.
Thematic words.
Thematic.
Exactly. Who can give me a Helen? Could you say hello? Could you give me an example of thematic words? What do you
Hello.
mean?
Like symptoms, headache, fever.
Yeah.
All of them.
The one I always use, guys, is cat, dog, fish. What's the theme,
From the
guys?
same family.
Animals.
Animals. Okay. So these are the ways to get main ideas. And we talked about this yesterday. There's more ways to get main idea. Belkis, can you say hello? Oh, keep your microphones off if it's okay, guys. So what's the other way to get the main idea? Belkis or Betul?
Sorry, yesterday I was absent.
That's okay. Can you guess, Belkis? They are here. Any ideas? Can anyone help her?
Yeah.
Words.
From the
Keyword.
signpost.
Keywords.
Keywords.
Okay. So by keywords, guys, we mean underlining. We're going to underline how many words?
4 to 5.
4 or 5.
Okay. So we're going to underline 4 to 5 words that we think are important. So for example, ARD, 50%, jaw. Okay. So what makes a good keyword? Everyone shout out. What makes good keywords? What about
Numbers.
Numbers, joggers.
now? Someone said unique. That's step 2. When I'm talking about step 1, not step 2, not unique, right? What did we say yesterday?
Specific words.
Numbers. What else did we say?
Numbers.
Come on.
Capitals.
Brackets.
Capital letters. Yeah, there we go.
Capitals.
Capitals.
Organ.
Or
Brackets.
anything.
Brackets.
Yeah.
Brackets.
exactly. Or anything that
Repeat it.
stands
Medical
out.
terms.
Yeah. Now, people are coming into my class a bit late, so sorry, I can't type now. Here we go. Okay, so we did this we did this yesterday. If you don't know what I'm talking about, that's because you need to watch the class from yesterday. It's available on the website. Very easy, okay? So, step one, we analyze texts. It's 2 minutes, okay? We're looking for the main ideas. Sometimes you will have a subheading. Sometimes you will not have a subheading. There are 4 ways to get the main ideas. Okay, we're also going to underline 4 or 5 words. This is keywords, and we're looking for numbers, brackets, capital letters, that kind of thing. What was the other way that I told you could differentiate texts? Does anyone remember?
Function.
Okay. Now this can be difficult, but the function, Noza, what does it mean, the function of a text? It is the
like how can I say like it tell you that
okay,
what is the job or
how we can identify
What is the task about?
Well, it's not what is it about.
no, it's not
Okay,
like
so I'm just going to mute you guys, right? This one, main idea, that is what is it about, right? But the function, do you remember does anyone remember what I said yesterday?
Yeah, it's what
Purpose of the
Mary,
What
please.
it does to you. What it does to you.
Yeah, sorry, and this is my fault. I should have nominated there. So Mary and Abdullah, can you guys put your microphones on? So this is what is it about?
Yeah.
Right? This was what
it does to
text
you.
does to reader.
Does to you, right? So can we have examples of functions, guys? Classification. What else?
Information.
Definition, guidelines. Okay. So these are just kind of what the text is doing to you. Now, don't worry if you're not. I don't normally emphasize this because you don't really need function. What is the most important way to differentiate texts? Ale, Akhtar, what's the most important one here? Belkis, Aigul, Sulaiman?
The main idea? Sorry.
What do we think, guys? Is the main idea the most important one? Is
the
that
main
right?
idea on keywords.
Yeah, it's this one. It's the main idea, okay? And you will see today we're going to do a mock test and you will see how the main idea is the most important, okay? But yesterday, this is what we were talking about. Step 1, analyzing texts, main idea, keywords, function. What is step 2? Can anyone remember what I told you step 2 is?
questions.
Question stamp.
So yesterday we talked about step 1. Today we're going to talk about step 2. This is how I always do it, all right? Step 2 is basically just answering questions, okay? But I'm going to teach you now, I think, the best way to do this, all right? So let's zoom in and we'll look again at my diagram, okay? Let's imagine you're in the exam, guys, all right? And you have your text, you have your main ideas, and you get this question. What should be prescribed to a patient under 16, okay? And I'm going to ask someone, just one person to speak to me, please. Muslime, could you say hello? Or Maria?
Hello.
First. Muslime, okay? See that question here?
Yes.
What text do we need to read to get the answer? Or what texts? Is it A, B, C, or D, Muslime?
Okay. Prescribe medication.
Yeah. So how many texts do I have to read here?
4.
Why would you read, Muslime, why would you read 4? Why?
2.
Right?
Just
you're just going to read these. You're just going to read
just
these.
medication. Okay.
Yeah. Trust the main ideas, right? The main ideas will 99% of the time be correct. You don't need to read 4. Okay, so that's the first point, all right?
Yeah.
Is it okay to read 2? Is it okay to read 2? What do you guys think? Yes or no?
Is it okay?
Yeah, it's not so bad. It's not so bad. Usually, usually you can read only 1, right? But 2 is okay. Reading 4 texts to get the answer is very bad. Why is that bad? Come on, everyone. Why?
It takes time.
Time.
You're not going to sit.
That's my point.
And I know this personally from personal experience. The first time I did the exam myself, I failed reading part A. Don't know if that makes you feel any better. Why did I fail? Because I did not differentiate the text very well. I did not analyze the texts. Instead, I spent all my time on step 2. Okay. So we know this, we're going to look in the medication text because of Muslime. How did you know actually that we should look in the medication text? It's this word, right?
Prescribed for medication.
Yeah, right. So when you read your question, you should, if your analysis is good, you should be able to kind of know where you're looking. Okay. And here the word prescribed tells us we need to check. Now, next step is, what is the next step? Can I speak to, please, Yasmin? Could you say hello? Or Saurab? Sepid? It would be great to have Saurab, actually. Whoever comes first. Ooh, or no one. Come on, guys. Please put your microphones on. Daniela? Shahat? Could you guys say hello?
Yeah, hello.
Hey, Daniela. Thank you, Daniela. So, next step. Once I decide that, okay, I think it's probably in these 2 texts or 1 text or whatever, what's the next step?
I need to see the function of the text A and D, so I can choose which text I should read all.
That's a very good point, actually, right? But I don't want to go into that today, but actually, Daniela, that's exactly right, okay? But I want to focus more on step 2, okay? But you're right, if you're good with function, you can actually differentiate these texts more, and you don't have to read 2, okay? But what I mean, Daniela, or Chahat, is usually students choose keywords. Do you do that yourself, Daniela? I'm sure you do, right? Sorry, I just muted you. If you want to put your microphone on. Usually you're going to choose a keyword here, guys. What does key mean?
Specific. Clue.
Key just means important, actually.
Yeah.
Okay, but what makes a good keyword? Francesca, could you say hello, Francesca? Just Francesca or Clara, if you could say hello.
Hello.
Hey, Francesca. So, Clara or Francesca, what's the answer? What makes a good keyword?
For me, a unique word.
Yeah, this is what I normally say. I mean, Paul says the same. Most teachers, we're looking for a unique word. Okay, what does unique mean, though, Clara or Jenny or Francesca? What do we mean by unique?
And a specific word, maybe.
Well, they're all
I don't know.
Jenny,
one word.
It's not the same one, like it's in the text.
Yeah, it's not the same one, right? Well, it's not going to be repeated many times. Okay, so for example, Jenny. Is this a good keyword here? B or ah? Is that a good keyword?
No.
Obviously not, because it's going to be repeated many times. Okay. So Clara or Francesca, could you tell us what is the most unique word here? What do I need here?
16.
Ah, what do we think, guys? Is she right?
Yeah, it can be.
Under 16.
Under 16, maybe, yeah.
Yes.
No, this is the thing. Can I have more than 1 keyword?
Yes.
Yes.
You can have 2 keywords, okay, 1 or 2. So just focus here that this is our keyword. I think everyone would agree this is the most unique part, right? Is patient a good keyword?
No. Prescribed.
Maybe prescribed. So you could have, let's call this one phrase, Clara, that's 1, right? You could also have a second keyword, prescribed, okay? So now we have 2 keywords. All right. So what we do here, what's the next step now? Anyone?
Simplify.
Yeah,
to simplify the question. What should be?
That's more for part B and C. We don't need to do that.
Okay.
We don't need. It's not a comprehension reading. It's just find the information. Okay.
So we see for alternative words, for example, prescribed mentioned here, it's medicine. So we go through to medicine, right, directly.
Okay, let's have an example. Okay, so let's put this on the board. So I'm going to give you I think you're right, but let's just say, for example, guys, let's say that we have here, can anyone give me a synonym for under? Synonym for
Below.
Below. Let's just say it says 16.
16 infant.
Okay, so let's say that I scan in my medical text and I find my keyword, right? Here it is, way. Now, Farah, what does that tell me?
It tells you that this is the exact answer of this question because you mentioned below 16, it means under 16.
Does it tell me that this is the answer? Are you sure it's the answer?
No, because the medication mentioned here, and we could find the under 16 too. So
well, this is my point. Okay, so microphone's off, guys. Right. So this does not the keyword does not give me the answer. The keyword, Dr. Saki, what does the keyword give me?
Keywords give me category.
It's not giving me the category. When I find the word here, it's giving me the
area.
Yeah,
Where
it
you
does.
can find
right?
the area.
Direction, the
I
right
think Paul
direction.
calls this, or I call this anyway, answer area.
Area.
Okay.
Yes.
So I'm not going to read all of that text. Does that make sense, guys? I'm only going to read inside this area. All right. Is that clear?
Yes.
The answer must be near to the keyword.
Yeah.
Around this.
It cannot be at the here. It must be near. Okay. Is that clear? Does someone have a question? I think someone had a question. Was it Katarina?
Yes.
Go
I
on.
don't understand the text. Medication, treatment, diagnosis, and medication again.
What do you mean? Sorry, you don't understand the text.
Yes. Yesterday I wrote the symptoms. It was D.
This is just an example.
Okay.
I think, Alan, all she's saying that medication is repeated twice in this.
Yes, this is my problem.
A and D.
Yeah, you have to read both if you did not. It doesn't matter. Okay.
Oh, okay. Thank you.
Oh, for this example, let's say, for example, this is symptoms. Okay, so there's only one text. All right, but the point is, this is my answer area, Catalina. Like this is where I can find the answer because I found under 16 here. Does that make sense?
Yes.
I matched the keyword. What do we call it, guys, when you're looking for specific words? What's the name of reading for specific words?
Scanning.
Scanning. So what I'm showing you today, guys, is how to get the answer in OET Reading Part A. Okay, so you choose a keyword under 16, you go to the text where you think it is, you find the synonym, all right? But now I also say there's something else you should do. This is something that I really teach, okay? I'm going to ask one of you if you know it. Akhtar, is there something else I need to think about as well? Could you put your microphone on, Akhtar? Akhtar or Ersin? Is there anything else I should be thinking about here? Ersin or Han? Or put your microphones on, please. I think I just muted everyone. Jelena, could you put your microphone on as well?
Yeah, I'm here.
Jelena, so there's another thing you need to find here. I found my keyword, but there's one more thing. Have you seen my videos? What is it that I'm also going to look for? Ersin, Akhtar, Huma?
Question.
I'm not that good in describing your
everyone, what is it? Everyone?
I said category.
So I was teaching a doctor the other day. Actually, he was a native speaker doctor. Because he studied in Romania, he had to do OET, but he's native, okay. And he had problems with reading A, even native speakers, right? Anyway, I was teaching him and he had some difficulty with this. So I want to make sure that everyone understands what I mean by category, okay?
Yes, name of the medication.
Category, well, the category is, what is category? Can anyone explain it? Someone said name of medication. Who said that? Name of medication.
I did.
Ersin, what is category? It's not keyword, right? Something else.
Yes,
What is it?
It is what question is asking. The answer, actually.
Yeah, it is the answer.
We divide it to categories. It can be name of medications, name of person,
Exactly.
name
Now,
of a procedure.
listen, nice. Now, I'm not sure everyone will get this, but if I show you an example here, I think everyone will understand. What should be prescribed to a patient under 16, guys? The answer must be a type of
Medicine.
Does everyone see that?
Yeah.
Right? That's what I mean by category. You should try to think about the category of information you're finding. It's really useful. And I'll show you, when we do our mock test, you'll see why. Let me give you some examples, because just in case anyone's not sure what I mean here, all right? Let me give an example. I'll make my screen bigger. Okay, big writing. What animal does Alan want to buy?
Cat.
Is it cat? Does everyone see what's the category of answer now? It's in the question, isn't it?
Animal.
Animal.
The answer must be an animal to that question. It cannot be anything else. You can't say, Italy, right? That cannot be the answer. Even if I don't know what the answer is, the answer cannot be Italy because the answer must be an animal. Okay, let's try another example now. Okay, what about this? How many times should a nurse give the medication? What's the category?
Numbers.
Times.
How many times, which is numbers, right?
Frequency of time.
The answer cannot be diabetes. Does everyone see that this is not a possible answer? Is that clear?
Yes, thank you.
Why is that not possible? Because it's not a number. The answer must be a number. This is what I mean by category. I'll give you another example, okay? So, what does Mr. Green need to help him with his mobility? What's the category of information? Mr.
Mobility aids.
Mobility.
What things help us with the mobility?
Equipment.
Equipment, right? It's going to be, for example, wheelie walker, wheelchair, walking stick.
Walking stick.
So this is a very, very useful thing to do in OET when you're looking at questions. You can usually get the category of information, and now that helps me to find the answer here. Okay, because what happens is I find my keyword below 16, right? And now all I need to do is find an example of what? In this example of what?
Medication.
Medication. So imagine here it says antibiotics. That's the answer, right? If there's only one. Does that make sense? The keyword tells me where. The category tells me what the answer is. Is that clear? Does anyone want to ask me any questions on this? Because I'm going to demonstrate it now. I will demonstrate. But is that clear for you guys?
Yes, thank you.
Yes.
So you find this and you go, oh, there's the drug. It's a medicine, answer medicine. Okay. This is very useful because it means you do not have to remember the question. All right. Does anyone sometimes forget the question? When you find your keyword, you forgot the question?
Yes.
You're wasting time now, right? You're wasting time. You have to go and read the question again, go and find it. You just need the category usually. Okay, here's a problem though, right? What if you find antibiotics and you also find paracetamol? What do I do now?
Ignore the paracetamol.
Ignore it. Maybe you can use your medical knowledge, right? But if there's two things, you have to read the question again and decide, okay? It's not magic. My technique is not magic. You must read the question again and try and decide, is it antibiotics or is it paracetamol? Okay.
Oh, sorry. I was confused about it. Like if you find the antibiotics and paracetamol, obviously you're going to ignore the paracetamol. But if you don't find the antibiotics, so you need to read again.
What I'm saying, exactly, this is what I'm saying. If both of these words are in the answer area, and they're both medications, then they are both possible answers. Does that make sense? So you need to read the question one more time.
But context give you the cue, because if this discussing, for example, infection, we need to go for antibiotic. If it discussing about the pain, we need to go for the painkiller.
This is where many of you will be better than me, because you can use your medical knowledge to decide, maybe, if you have two possible answers as well. Okay. Now, what we're going to do today, guys, is I'm going to show you this technique in real time. We're going to do a full mock test, and you will see me doing everything that I spoke about here. Is everyone ready to try a full mock test now?
Yes, please.
Yes.
Okay, and I'm going to say goodbye to